Okay, we're going to start our next week with Chapter 15, which is Pregnancy, Childbirth, and the Puerperium. You can see that these are O codes, and kind of think of a O for obstetrics. And remember that it's always an O in that first slot, so this is O00 to O9A. We do have some general rules here. The main one, which I've referenced several other times, is that this chapter has sequencing priority over codes from other chapters. So there may be a couple exceptions. We'll look at one at least, but for the most part, typically your obstetric code is going to be first, and then you have additional codes after that. We also assume that whatever is ailing the mother is a complication of pregnancy unless the provider states otherwise. So it is the provider's responsibility to state that the condition is not affecting the pregnancy. And in that case, we would use this Z33.1 pregnant state incidental. This would come after whatever condition the patient's coming in for. So maybe a patient, I don't know, cut her finger and she's coming in, so that finger cut would be the principal diagnosis and then, or first listed diagnosis, and then you could put the Z33.1 as an additional diagnosis. And remember that these obstetric codes are used only on the maternal record. The next couple chapters we'll look at the complications that might appear on the newborn's record. All right, this is a big change in ICD-10. Those of you that were familiar with 9, our fifth digits, always indicated whether the patient was antepartum, postpartum, or if they delivered on the admission. Now we don't really look at that. We're looking at trimesters, and we don't necessarily have fifth digits anymore, but typically in these codes the seventh character extension is, or not the seventh character extension, just an additional digit is to indicate the trimester. So be really careful with these, just like you were with ICD-9, when you're looking these up in the index, to make sure you go back to tabular and capture all of your digits, because you do always have to capture in that trimester. So here's our definitions of the first, second, and third trimesters: 14 weeks, 14 to 28, and then 28 weeks to delivery. So this is one of those things that we're going to have to make sure is in the documentation, that we know the gestation of the pregnancy when the patient is seen. It's going to be based on the trimester for that current admission. If an inpatient admission ends up going over a trimester, so maybe the patient comes in their second trimester, but they end up staying until their third trimester and delivering, for the condition that they were admitted for, that condition that was happening in the, let's say, the second trimester, we're going to assign the code for that. So when the complication developed, not necessarily when they were discharged. There is an unspecified trimester available, but as always, we want to try to avoid that as much as possible. I do quickly want to mention, I don't have this in the slides, but there are some seventh character extensions in the obstetrics chapter, and I think you'll see one of these on one of the practice questions. They have to do with multiple gestation pregnancies, twins, or not multiple gestation, but twins or triplets or something like that. The seventh character extension will indicate which twin is being affected by that condition. So the example, I think, on your practice, it's twin number 1. So it will indicate which fetus is being affected by that particular condition. And so each twin or fetus would be coded separately, and then you could indicate which fetus is affected. There's also an option if it's something that is affecting just a single fetus pregnancy. There's an option for that as well. Alright, so when we're looking at that principal or first listed diagnosis, if the patient's just coming in for routine prenatal visits, we have a Z34 code. If it's a high-risk patient, we have O09, supervision of high-risk pregnancy, and then here typically you would have an additional O code to specify what condition is making that patient high risk. If the patient doesn't deliver on that admission, you're going to use your principal complication of the pregnancy that necessitated the encounter. If a delivery does occur, it's the main circumstances or complication of the delivery. So if they had a C-section, why did they have a C-section? What was the condition that led to that? So these are really the same guidelines that we saw in ICD-9. We also still have an outcome of delivery code, which is Z37. So this is going to be an additional code that's added on anytime a delivery occurs. So make sure you always remember to add that outcome of delivery. And again, remember that this is for mom's chart. We'll look at baby's chart in the next lecture. If there are fetal conditions that are affecting the management of the mother, here's a couple categories, 035 and 036. Remember that these are only assigned if that fetal condition is actually affecting the mother. So sometimes there can be fetal conditions, but it really doesn't change any sort of management with the mother. So in those cases, you don't need to worry about coding those. They will, if they're still present at delivery, they would be coded on the newborn's chart, but they don't need to be coded on the mother's chart unless for some reason it is affecting the care of the mother. If the patient, if the mother has in utero surgery, the fetus technically isn't a patient yet, so it's still an obstetric encounter. So you get an 035 to indicate that there's maternal care for some sort of fetal abnormality, and then of course you'd code your procedure as well, and any sort of other complications that are found. Just a couple more guidelines, and these are really just dealing with things that came up in some other chapters. We talked about sepsis. There is 085 for puerperal sepsis, so sepsis that's occurring in that postpartum period. So you would sequence that first. You would have any sort of code to identify a causal organism if that's known. If the patient does have severe sepsis, that's going to be an additional code, that R65.2, and then it's some sort of additional character. And then again, remember, severe sepsis indicates that there is some sort of organ dysfunction, so we want to code that as well. So you end up with quite a few codes there. With alcohol and tobacco use in pregnancy, we get 099, either .31 or .33. This just is telling you that you also need a code to indicate whatever that alcohol or nicotine related disorder or dependence is. If there are any sort of adverse effects or poisonings or underdosings, anything like that in pregnancy, no, we're not quite to that chapter, but this really is the same kind of rules. Here we end up with our obstetric code first, the 09A.2, so that indicates it's happening in a pregnant patient. Then we get our poisoning or adverse effect or underdosing code. We would also have any sort of manifestations that were in there, and then which would fall under this condition caused by the poisoning, toxic effect, or adverse effect. We do still have our normal delivery code, which is 080. So remember to code this. ICD-10 terms of a normal delivery means that it's full term and it's uncomplicated. So it has to be a single healthy infant. So if it's a stillborn or if it's twin pregnancy, it can't fall under this. If it's preterm or prolonged or post-term, it can't fall under this code. There can't be any complications that are still occurring during the delivery. So they could have had antepartum complications, but if they're resolved by delivery, then that's still okay. If there's anything that's unresolved, it falls out of the normal delivery code. And same thing with postpartum, that occurs within kind of that before the patient's discharged. Obviously, if it's postpartum, 5 weeks later, we're not going to know that at the time. It's always going to be a principal diagnosis because there really is not much of anything else to code other than our outcome of delivery code. And it can't be used with any other codes out of the obstetric chapter because there wouldn't be anything else to code. There's no complications. There's no instruments used during the delivery, so if there's like a forceps or vacuum extraction, there has to be some sort of reason for that, which would put it outside of the normal delivery. There can't be a C-section because, again, there would be some sort of complication, so that doesn't fall under normal delivery. So pretty much with these, if patient falls under normal delivery, they get code 080. They get an outcome of delivery, which can only be Z37.0, a single live birth, and then typically they'll get the procedure, which I lovingly call catch the baby code, which basically just means the physician was there to make sure that the baby came out okay and caught the baby when it was there. All right, in terms of our peripartum and postpartum periods, peripartum just kind of talks about the last month of pregnancy up to 5 months postpartum. One of the conditions that can arise in that period is cardiomyopathy, which is this 090.3 code. Postpartum, we still have our 6-week mark, so 6 weeks after delivery. If something occurs past that period, you can still use those codes if the physician is indicating that it is pregnancy related. Sequela, so again, this is kind of our new terminology for late effects. We have 094. If a patient develops something that stays as sequela after that, then we're going to use that 094. Now this is kind of an exception to that sequencing rule. Notice that your sequela is coded first and then your 094. But again, this is going to be occurring a fairly significant period after the patient delivers. So this really is what the patient's coming in for. Think of this 094 as that late effect code. In terms of abortions, just a quick note here, I realized I didn't have this for terminology. A miscarriage, kind of the synonymous term here, is spontaneous abortion. That'll come up on one of your practice coding questions. If an abortion results in a live-born fetus, we still use that preterm labor code. Now it's 060.1. Then you would still have your outcome of delivery code, and then of course your procedure code in terms of any sort of termination of that pregnancy. If there are retained products of conception following an abortion, we have that spontaneous abortion code, or if they're coming in for elective termination of the pregnancy. All right, so here's our practice. Let me read through it, and then this actually is a fairly easy one to code. I probably should have picked a little bit more complicated one, but here our patient is admitted in labor at 39 weeks, cephalic presentation, delivered vaginally, and we have no complications. So it's limited information, but we know the patient is 39 weeks, which means she's term. It's cephalic presentation, which is normal. She delivered vaginally. We don't have any mention of instruments used, and we had no complications. So these are kind of all those different things we want to check to indicate a normal delivery. So once you figure that out, it's relatively easy to code. So let me switch over to my browser. And I went under delivery as my main term, and then here's normal as a subterm. I'm on page 351. We get that code 080. So we can take a look at that in our tabular. Let me get all the way back up to the top here. So here's 080, and this is one of the very few in this chapter that is just a 3-digit code, or 3-character code. So encounter for full term uncomplicated delivery. So notice here it does give us kind of all those specifications of what indicates a normal delivery. So minimal or no assistance. It can have an episiotomy or not. No fetal manipulation. So that's what I'm talking about with in terms of instruments. It has to be spontaneous, cephalic, vaginal delivery, full term single live-born infant. And then notice here we want to use an additional code to indicate outcome of delivery. And in this case, Z37.0 is the only one that can be used. And so since we already got that code, here's Z37, outcome of delivery, .0 single live birth. Again, if it were a stillbirth or twins, multiple births, anything like that, that's going to kick us out of using the normal delivery code, that 080. I did also want to point out in the index, if we didn't capture that code there, you can go to outcome of delivery. Whoops, if I can spell. See if I can find that. Here we go. So it's on page 932, outcome of delivery, and then here's single liveborn. Z37.0. So here's that 080 for normal delivery, Z37.0 for our single liveborn.